Are you having a hard time coping with symptoms of anxiety? Are you considering seeking medical treatment for anxiety? If that's the case, then the next recommended step is to contact a qualified healthcare provider and make an appointment to discuss your options. In the meantime, you may be wondering about medications that are available. Here is a brief overview of the most common anti-anxiety medications prescribed. 1. Selective serotonin reuptake inhibitors, or SSRIs. Some examples are fluoxetine, also known as Prozac, sertraline, also known as Zoloft, escitalopram, also known as Lexapro, and many more. SSRIs are effective in treating various anxiety disorders, including generalized anxiety disorder, social anxiety disorder, and panic disorder. Once initiating treatment, it may take several weeks for symptoms to improve. SSRIs are not addictive, but suddenly stopping these without doctor approval can result in withdrawal syndrome. So be sure to follow your provider's instructions. Side effects can include nausea, diarrhea, insomnia, sexual dysfunction, and weight gain. Overall, SSRIs are generally well tolerated with relatively few side effects and are often prescribed as first-line treatment due to their safety profile. 2. Serotonin norepinephrine reuptake inhibitors, or SNRIs. Examples include venlafaxine, known as Effexor, and duloxetine, also known as Cymbalta. These are also effective in treating anxiety disorders, particularly for individuals who do not respond adequately to SSRIs. These also require several weeks for improvement to be seen, and may cause withdrawal syndrome if stopped suddenly. Side effects can include nausea, dizziness, sweating, and increased blood pressure. These tend to have fewer sexual side effects compared to SSRIs. 3. Benzodiazepines. These include drugs like Xanax and Valium. Benzodiazepines provide rapid relief of anxiety symptoms, often within minutes to hours. They are effective for short-term management of severe anxiety or panic attacks. They can be helpful as add-on treatment during initial therapy with SSRIs or SNRIs. It is important to note that there is a risk of dependence and even addiction with long-term use of benzodiazepines. For this reason, they are typically only used for short periods or as needed for occasional moments of increased anxiety. Sedation, drowsiness, and impaired coordination are common side effects. 4. Buspirone. A non-addictive medication effective in treating generalized anxiety disorder. Does not cause dependence or cognitive impairment, making it suitable for long-term use. It takes several weeks to reach full effectiveness and is less effective for panic disorder and other acute anxiety symptoms. Side effects can include dizziness, headache, and nausea. Again, this is not an exhaustive list, but simply the most common drugs prescribed for anxiety. It's important to note that medication effectiveness and tolerability can vary from person to person. While some persons may improve quickly on a single medication, it may take several months of trying multiple medications, possibly in varying combinations, for others to achieve the desired effect. Decisions about medication choice should be made in consultation with a qualified healthcare provider. Your provider may recommend one drug over the other based on medical history, current medications you are taking, cost, side effects, or more. If you'd like to learn more, check out our other videos.